Start this lower limb exam looking at John's feet, knees, and hips, and how they're aligned and how he distributes his weight. I'll have him stand on one leg. Because he's a fit, young, healthy individual, he should be able to do this for 5 minutes with his eyes closed. I'll have him do a single leg squat, looking for any internal rotation of the knee. Then we'll check his calf length. And with this test, you want to see their knee go over their toes. Have you lay on your back on the table. Do a bridge for me. So put his pelvis into a neutral position. I'll straighten out his legs and look to see if his malleoli are at the same level. I'll do the same thing at his ASIS. Then I'll palpate his pubic bone for any asymmetry. And I'm going to palpate along his adductors. I'll put him in a figure 4 position. Any tenderness on the adductors or the pubic bone indicates an osteitis pubis. And then I'll palpate his psoas for any tenderness. Any tenderness indicates the body is unhappy with its load. I'll have you stand at the end of the table. I'm going to perform a Thomas test. If you move your chest, hold it. This checks for psoas tightness. His knee up here, it will show that his psoas is tight. It's down here, it shows that his psoas is normal. You can slide back on the table, slide towards me. We're going to do a straight leg raise. This tests neural length. Any pain here indicates pain referred from the back. We're going to do a 90-90. Test hamstring length. Then I'm going to do a quadrant test. This moves him through the full range of motion of the hip. Any popping indicates a labral tear. And any pain indicates impingement of the synovial fluid. Next, we're going to move to the knee and do a hyperextension test. You want to make sure that they are equal on both sides. And then we're going to do the patellar glide. The patella should move 2 centimeters in all directions. And next we'll do a Lockman's test. This test for an ACL injury, and if it does bounce back, then it shows that the ACL is healthy. If not, it indicates that there could be an injury. Then we'll do a Valgus test. This is testing for the MCL's health. Then we'll do a McMurray, which tests the meniscus. Move the knee through its full rotation. Any popping here indicates some injury may be in the meniscus. Then we'll test his VMO versus his vastus lateralis. They should fire at the same time when he tightens his knee. You tighten your knee. And I'll have you lay on your side. I'm going to palpate his greater trochanter. Palpate down his IT band. Then I'm going to put him into an extended, abducted, and internally rotated position. Have him hold that. Any weakness here indicates a possible bursitis, and any pain indicates possible gluteal tendinopathy. I'm going to do an over test. Pull his leg back like this. His knees should be able to touch the table. Then we have you lay on your stomach. We can do an Eli test. His heel should be able to touch his bum. Compare that to the other side. Then you palpate along the glutes and along the hamstrings. Have him do a straight leg raise. You want to feel if his glutes fire before his hamstrings. And that completes our lower limb exam.